one of the questions that arises is what are the different symptoms of different strains of Borrelia infection? As you know, the original diagnostic test was developed from Borrelia burgdorferi sensu stricto. This is the bacteria that was first isolated in Old Lyme, Connecticut, and all of the testing that has been developed, antibody test, has been based on this prototype, the bacteria that was isolated in Old Lyme, Connecticut. But the strains of Lyme, Borrelia, in Europe are different than the strains of Lyme in America. So rather than Borrelia burgdorferi sensu stricto, patients in Europe are also infected with other strains, for example, Azafree, Guerini, and these infections may present in different ways. It's not been well characterized as to what the different clinical manifestations of these different infections are. We think Borrelia burgdorferi sensu stricto may present more with joint problems, and for example, Guerini may present more with systemic and neurological manifestations, but the reality is that Borrelia burgdorferi sensu stricto, Guerini, Azafree, and there's other strains of Borrelia miyamotoi, which is relapsing fever borreliosis. They have multiple different manifestations. So some people may just manifest with non-specific flu-like syndromes and fevers. Some people may present with neurological disease. Some people may present with joint. Some people may present with peripheral neuropathy. Lyme, as you know, is the great imitator, and it can spread to multiple different organs. So different strains appear to have different tropisms, but it's not been well characterized. So any mystery illness, as far as I'm concerned, where there's a suspicion of Lyme disease, whether it be rheumatological, neurological, or non-specific symptoms, Lyme disease, borreliosis, should be entertained as part of the differential diagnosis.